Afternoon, everybody, and welcome to this month's Interagency meeting. I'm Alison Wells. I'm Community Engagement Officer with the Council. My colleague Mark usually does these meetings, but he's off sick at the present time, so you've got me today. If anybody, is there anybody who hasn't been to one of these meetings before? Right, oh, a few. Oh, well, you're very welcome. So what we normally do is go round the screen. I'll introduce someone, and then you get a few minutes to say a bit about who you are, who you work for, and whether you're just sharing information about your service, that's fine, or some people have a particular ask. And then if anybody's got any questions, we'll take those, but do remember to introduce yourself and where you're from when you ask a question. So, right, I am going to start. I'm going to start with Martin Burton, as he was first in. Very welcome, Martin.
Hiya, my name is Martin Burton. I'm the chair of Keynsham Community Hub, which is a small community centre in Keynsham, used to be known as Community at 67.
Do you want to carry on and do your, is that all you're going to say, Martin? You're going to say a bit more about it, or particular ask?
I'm really here to to listen, really. I mean, the only thing we like everyone else, we're going to do a major lottery bid to the Reaching Communities Fund. I think things are going well. We run a mother and babies group, which got lottery funding for babies 0 to 6 months. That's going very well. And we're in the process of arranging a scam day with B&NES trading standards and a local computer shop to allow people to come along with their confidential waste and get it disposed of free of charge, along with floppy disks that some people might remember, hard drives, things they want to dispose of safely. So we're looking at doing that in July.
That sounds really good. Excellent. So is there anybody here not aware of Community at 67 who aren't Community at 67 anymore? Keynsham changed your name to, is it Keynsham Hub?
Keynsham Community Hub, yeah. We're small, I mean, we're very small. We've got 2 rooms, mainly for small groups. And we just run a load of activities during the week for groups. Yeah. If anybody wants to work with us, we're very open to partnership working.
That's brilliant. Thanks, Martin. Has anyone got any questions for him?
I have a question, Melissa? If you don't mind. And I apologize if you did mention this, but who are those that you support? Is there age group? Is there what's your demographic?
So it's really a geographical group we support. It's Keynsham South, which is one of the more deprived areas of Keynsham. So it's the areas, I don't know if you know Keynsham South, which is on not the Shandag side, the other side of Keynsham. So we say we're in a babies group, we're a code group, we do groups for adults, we do community learning groups. So we're very much a venue. We are proactive in arranging groups, but also we allow people to use our space as well. So if people want to work with us, to reach out to a group that want to reach out to them, we work with them. We're not funded by anybody. We don't get any funding, and we run entirely by volunteers. We don't have any paid staff at all.
Fantastic. So do you loan your, if for lack of a better word, your facility out?
Yeah,
if another organization wants to run a hub or whatnot?
Yeah, okay. Absolutely. And we need that money to keep us afloat. So in order for us to remain viable, we hire our premises out to groups. The facility is owned by Keynsham, so we do pay commercial rent to them, which is a bit of a bone of contention. But so we have to raise some money to pay our rent. So if you want to work with us, contact me and we'll have a chat.
Thank you.
Brilliant. Thanks, Melissa. And what organisation are you from? I'll go to you next to do your bit.
Me as in Melissa?
Yeah,
it's not an American organization. Just throw that out there. I work for SAFA, and I have joined SAFA about 2 months ago, and I am senior statutory grants officer. So my remit is really, you know, building awareness and reaching out to the statutory world, if you will. And I cover all of the west of England, including the southwest, which I mean, I'm hoping that everyone here is familiar with SAFA. But if not, it stands for Soldiers, Sailors, Airmen, and Families Association. So I would actually have an ask for you all is that, you know, I'm gathering that you are local. This is an interagency meeting. And as I am, you know, meeting people and really starting to learn about the area in the statutory world, if anyone has any suggestions, if you have anyone you think would be helpful for me to meet, I would be grateful. And if you would like my email address, then I can pop it into the chat.
Lovely. Thanks, Melissa. As well as being Community Engagement Officer for the Council, I'm also the lead for the Armed Forces Covenant. So I'm the person you need to liaise with. And I'm based at our Community Wellbeing Hub. And that is our one front door for residents, but that obviously includes our Armed Forces community. So I'll pop my email in the chat as well, and we'll catch up separately to talk about that. That'd be lovely.
Oh, great. Brilliant. Thank you.
Anybody got any questions for Melissa? I'm going to move on to Julie Osborne. Hi, Mel, sorry.
Hi, Alison. Hi, everybody. Hi. Sorry, I was a few minutes late. I couldn't locate the joining instructions, so I was a bit late. So I missed what Melissa said. So I guess that will be in the
we're
notes of the meeting
now. Yeah.
Oh, okay, that's fine then.
Yeah.
Okay.
So you can catch up at the beginning. But yeah, Melissa's from SAFA.
Oh, okay. Yeah, I thought, yeah, that makes sense with what you then said, Alison, about the armed forces. Okay, apologies for being late.
No problem. Right, Julie Osborne, welcome.
Hi there. Hello, I'm Julie Osborne. I'm from the Alzheimer's Society. I'm the local services manager for our services in the B&NES area. We have our commissioned dementia advice service. So we support anybody in the area who is affected by dementia. That can be the person with the diagnosis, or it can be their family or friends as well. So we do that through contact, telephone contact, post or email, but also going out and seeing people at home and talking to them in their own environment and helping people understand a bit more what their diagnosis means, and helping people access local support, understand the social care system, make sure people are getting the benefits that they should be getting, and helping people identify kind of strategies for living well with their diagnosis and the symptoms that they might be experiencing. We also have some other services. So we have a Singing for the Brain group in the Western area, which takes place a couple of times a month. We have companion call services. We've got, we also offer a carers information and support program as well. Main thing that I wanted to promote today is that we've got a awareness. So this week is Dementia Action Week, and we've got an event going on at Poulton Hospital tomorrow, which is open to anybody who wants to attend. So it's tomorrow 11 till 2. What I'll do is put the details in the chat there. So if you know of anybody that would benefit from coming along, there's going to be lots of organisations there locally who support specifically people that have got a diagnosis or their carers, but also other organisations as well. So please share that. Thank you.
Thanks, Julie. A couple of questions for you. Mel first, I think.
Sorry, that's a
legacy
old
hand.
Legacy hand. Sorry, I don't know. It normally goes down automatically. Sorry, I'll lower it. Apologies. Oh dear. What am I like today?
Rachel, you got a question for Julie?
Yeah, thank you. Hi, Julie.
Hi.
I was just about that event. typically I can't do that tomorrow, but is this an event that happens regularly, or ad hocly or something? Because that'd be something that would be really good for me to come to.
Yeah, this is so we've kind of arranged this specifically because it is Dementia Action Week this week. So there are a couple of other things that we're doing as well. So, but I've had we'll see what the turnout is tomorrow. We've had quite a lot of interest from organisations wanting to come along. So there's obviously an appetite for events like this. So, but yeah, I can certainly, if we do anything else, I can certainly link you in.
Yeah, let me know. It'd be great. Thank
you.
Sure.
Okay.
Thank you. I'm going to move to Anne Donaghy. Welcome.
Hi. Yeah, my name's Anne. I am a support officer at the Carers Centre, and I will be at the event tomorrow. We have a stand there, so if anyone does make it there and they want to have a chat with us about what we do, then come and say hello to myself and Fiona, my colleague, who's going to be there. So we are an organisation that support people who are in a caring role for family or friends, that kind of thing. It's free for carers to register. All of our activities are free. All of our services are free. So I like to think that there's no catch in getting in touch with us and accessing support, given those circumstances. We work with adult carers of all ages. So we have lots of people caring for partners with dementia. We have people supporting parents who are, either have health issues or just are finding things a bit more challenging as they get older. We also have lots of parent carers who are supporting children with special educational needs and disabilities. We also support young carers. So young carers from 5 upwards, basically we have a team that support them. They have activities that they can access. They can also have young carer assessments as well, if that's something that would be useful to them. So we cover quite a range. In terms of the adult services, so I'm part of the support team. We basically, one of our big things is we have a free phone support line that carers can call into, and we get all sorts of weird and wonderful questions coming our way. Most of them are ones that we can answer. We do get some where we're kind of unsure why they've called us, but we always say, if you're not sure, do call us, because at least if we don't know, we can signpost you to someone that does. We can help with a variety of things. So sometimes it is just emotional support, carers that are finding things really challenging and just need a space where they can offload. And a lot of people say it's helpful to do that with somebody who's not part of the situation, so not friends or family. They kind of like the fact that we're different. We can support with things like helping people understand how to navigate the system around care and the NHS and things like that. We also have support for carers around cost of living and financial sort of challenges. So we have Carers Money Matters project at the moment, where we can talk with carers about a variety of things. So it includes their home energy usage, their home energy stuff. So we have an energy advisor that works on the project. He can sometimes help people access grants or at least save money on what they're using in the home. We can also give them guidance around benefits, debt kind of guidance. Also things like the Priority Services Register, which if you don't know what that is, maybe Google it and find out, because you might be entitled to be on it. But a whole range of things that might be beneficial to carers around kind of money. We have access to some money for grants. So if you know carers that are struggling financially, it's worth kind of giving them a heads up that they could potentially access a grant to support them around the cost of living from us. So typically it might be a couple of £100 at the moment. And we can help with things like supermarket vouchers, money towards energy bills. Sometimes it's things like people wanting like white goods for the house, that kind of thing. But we do get a range of inquiries. So you know, there's not like a definite no on anything. You know, talk to us if you're not sure. As part of the Dementia Action Week, we've also produced some new resources for carers who are supporting people with dementia, and I'll put the link for that in our chat as well, because that's quite a big part of what we do, I guess. But we've got some podcasts and a dementia guide that people can access. That's a lot of information. I think, just looking at my little list, I think I've covered all the things I wanted to cover. But if you're not sure and you want to get in touch separately to talk things over, I'll put my email in the chat. And also, if you want to signpost carers to us, I'll put the email for carers to contact us as well. And then we can help them or you. Okay, that's me.
Lovely, thanks, Anne. Has anyone got any questions? No? Lovely, thank you. I'm going to move on to Louise. Hi, Louise.
Hello, sorry, I was frantically writing down people's email addresses from the chat then. Hi, I'm Lou. I'm from AGK B&NES. I'm the Information Advice and Signposting Senior Lead. So essentially the advice service, but I have a nice long weird job title to encapsulate all the weird and wonderful things we do. And as like Anne said, we get asked some weird and wonderful questions at times. Most of it's very relevant, but sometimes very vague. So AGK, sometimes you might have known us as Age Concern. Just to myth bust, we haven't been Age Concern for 25 years, but people still call us Age Concern. We are AGK, we're part of the national charity, and we operate here in B&NES. There are lots of franchised AGKs across the country, usually county-based, so you may know them from Wiltshire or Somerset, etc. So we work in partnership with them in a very light way as part of the national charity, but we are separate entities across county lines, just so if anyone thinks, oh, we could just ring AGK Somerset and fix the problem. It's not quite that smooth, unfortunately. So yeah, we're centred here with B&NES. We're part of the Community Wellbeing Hub. We're one of the partners there. I'm very proud to be so. There's definitely a few people I will be emailing after this meeting, especially things around the Armed Forces Covenant and looking after our veterans, because we do get some, every now and then, some very left of field inquiries. So to be able to link up with Safa and Alison will be fantastic. We'll also be at the event that Julie mentioned tomorrow at Polton Hospital. I'll be there along with my colleague Kerry, who runs our social groups. So AGK B&NES, we offer the information advice service, and all our that's a free service. We have social groups, some of which are free and some of which are paid for, which do include things like Singing for the Memory, our dementia groups, as well as more low-cost social groups. We have our at-home service, which is paid for social care, which people can basically use as much as they can afford, and also has a reduced rate for if somebody's on a low income or on benefits. And then we're also part of the Home from Hospital contract, which supports all adults as they leave hospital to get them that initial 6-week bridge from coming out of hospital and not having to return to hospital as soon as possible. So hopefully it keeps them independent. And that often works in partnership with re-enablement and all the other services that come along with leaving hospital. But that is a service for 18 plus. That's not just for older people. That's for any adult using local services. Yeah, but that's us. I'll put my details in the chat, and I'll also put the advice email. So if you've got any clients that might need our support, whether there's someone supporting someone who's older, so they're a carer or they're looking after mum and dad or aunt and uncle, or they're an older person, then they can contact our advice line. And then if you guys want to contact me direct, I'll put my contact details in the chat.
Thank you, Lou. Anyone got any questions? Has everybody heard of our Community Wellbeing Hub? Yeah, lovely. Don't need to explain that one to anybody here. That's good.
May I ask one quick question? I apologize.
Yeah.
I apologize because
No,
I have an
that's fine.
accent. I have an accent. Can you say again, Louise, where you're located?
Oh yeah, here in B&NES, Bath and North East Somerset.
Okay. Okay. Thank you. Thank you so much.
People shorten it to B&NES. You'll hear that a lot.
I used to work for the council.
It can mean the council, but it can
Yeah,
also
I
mean
used
the
to work-
geographic.
Yeah,
It's Bath and Northeast Somerset, right?
yeah.
Okay.
It's having worked for the council, the mouthful got too much. I got used to just saying B&NES.
Yeah.
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 Thank
And
you.
I mean, administratively, just to confuse you further, geographically, we sit within Somerset. So
Yes.
if you live in Bath, you're in Somerset as a county, but administratively, the council is Bath and North East Somerset, and it doesn't sit under Somerset County Council, just to confuse you further.
Well, if it was simple, it'd be boring, right? So why not? Just kidding. Thank you.
So, on the topic of old people, we've got our community contribution fund is open at the moment. Closing date is the 30th of May. It's small grants at the moment for new projects for over 55. So I just thought I'd throw that in there since we just heard from Age UK BANES. So that's a fund that myself and my colleagues look after, and I'll pop the link into the chat. And when we say new, it can be an existing project, but in a new area of BANES. It's a Kickstarter fund, really, because the grants are small. We want to try and do something so that people can try something out that's new, with the hope that eventually it will become a longer term thing. So I'll pop that in the chat, and while I do that, I'll move on to Anna Dietrich. Welcome.
Hi everybody, thank you very much, Alison. I was just thinking, like, the boundaries and the different administrative areas, and then I thought, should we throw in the ICBs as well? And then it's just kind of yeah, there's so many different things that you need to consider, especially Melissa, if you oversee the West of England, there's a lot of different ways of how things are patched up. It's really interesting and slightly overwhelming at times. Hi, my name is Anna and I am from Clean Slate. I am the regional lead for the West of England, which means I oversee our services in BANES and Bristol and South Gloss. Yeah, Clean Slate, as many of you might know, we're in the business of trying to make a big dent into poverty. We're trying to support around financial resilience, financial inclusion, digital inclusion, and employability for those on low income, struggling financially. We offer remote support services, 5 to 6 weeks of phone sessions, one-to-one over the phone with people that would like some help. It's free, and the average financial gains we're seeing for people that complete the service are about £1,328. We achieve that by making sure everybody's getting everything they're entitled to, make sure they're on the right tariff, see if there could be any changes in spending habits to make pounds stretch a little bit further. And we're trying to go in really high upstream and do like all the preventative work that we can, because what we have found is if you, obviously we all know that if you go in high, then you prevent crisis and hardship and a lot of trauma. So at the moment we're trying to focus very much on homelessness prevention. So looking at people where we've done some research about it. We've done a cost of living survey, and what we found is that the first indicators of homelessness further down the line, if you will, are if people start struggling to pay their bills. Once they start struggling to pay their bills, they might take out debt, or they might be not able to repay their debt, and then from there it goes into maybe not being able to pay rent, going for loan sharks. And so there's a lot of stuff that is happening. So what we're trying to do is basically help on the very top, ensure that people are able to manage their bills in the best way possible. And we also help around employability for those furthest away from the job market. So we're looking at people that have been long-term unemployed, and for that mainstream provision might not be quite the right step yet. So we have peer worker programs across different areas of the organizations where we give a placement, 3-month work placements to people for 3.5 hours of paid work if they're interested in it. And by now, I think 75% of all our staff are former service users that have come through the service, and 100% of our team leaders are former peers that came through the service and have joined our team since. We also have Quidzin, which you might have come across as a money magazine, which comes out quarterly and addresses ways of how one can make their money stretch a bit further. We have dedicated guides. One is about UC, so universal credit. Then we have one on social tenancies. We have one on heat, light, and power, how to save a bit of money on utilities. So there's lots of different mags and guides that we offer, as well as online reader clubs for clients, but also for professionals like yourselves, where you can sign up and hear about what we're up to and what are the newest changes in legislations and things that you might want to keep on top of as professionals. But as I said, also on the client-facing side, we have the Quizzing Reader Clubs and the professionals as a Quizzing Professionals Network. I'll pop all my information and my links into the chat box. But yeah, if you have any questions, let me know, or if you want to get in touch, just pop me an email over, and I'd be very happy to hear from you. Thank you very much, everyone.
Thanks, Anna. Has anyone got any questions? No? Okay, I'm going to move on to Helen. Welcome, Helen.
Hello, thanks for having me. I'm from Marmalade Trust. I know I've worked with some of you before, there's very familiar names. So Marmalade Trust aims to reduce the stigma around loneliness, basically get the conversation going. So at a national level, we campaign, and our founder, Amy Perrin, campaigns hard to just get people talking about loneliness, not as a mental health condition. We're not combating it, we're not fighting it, we're living with it and supporting people to make new connections to start their journey out of loneliness. But we do education, so we go into schools, and I just love the analogy we use with children, where we say if you're hungry, your body's saying that you need to get some food. If you're thirsty, it's your body saying, I need a drink. And if you're feeling lonely, it's your body saying, you need a little bit more social connection, or a different quality of social connection. Obviously, you guys are all in the same sector. We know the importance of connection and connecting people. So the charity started 12 years ago, and sort of our office is in St Paul's in Bristol. And historically, we have taken referrals for people on sort of on the ground projects from B&NES, so Bristol, North Somerset and South Gloss. And we are expanding out now. So I'm very happy because I live near Keynsham and I know community at 67, or what the community hub now. And so I'm excited that we're now reaching out into, so obviously B&NES, Bath and North East Somerset, and also Gloucestershire, Wiltshire and proper Somerset, as it were. Although, Alison, I know what you mean. It's really complicated. So on our website, there's loads of resources and assets to do with loneliness at all different stages of life. So if you're working or supporting someone who has, I don't know, as a new mum experiencing loneliness, or recently retired, or somebody who's working from home and feels disconnected, there's lots of support and resources on there, and mainly just saying, you know, it's quite a usual thing. Our Marmalade Connections project is what I'd most like to let you guys know about. So that is a volunteer-led 15-week support project based on the social prescribing model. So I don't know if there's any social prescribers on here today, but we often work quite closely with social prescribers. We support somebody, a project member, who's experiencing significant loneliness and just needs a bit of support and connection to make that first step. So a volunteer is matched with a project member for up to 15 weeks of weekly phone calls. So the phone call lasts about half an hour, and then the volunteer also does some research, because the ultimate aim is that that project member is signposted to other services, and then the volunteer sort of hopefully motivates them and encourages them over those 15 weeks to actually, you know, ring the centre, ring the organiser of the lunch club, ring SAFA, ring community at 67, or go on down and get somewhere. And the changes can be very, very small. We've got one guy at the moment who felt very disconnected from everything. He used to love drawing. His wife passed away. He didn't feel he could anymore. 15 years later, the volunteer has supported him enough that he has gone out and bought a pack of special pencils. I'm not an artist, but, you know, artist pencils. And the next week, when he had a little bit more money, he went out and bought a sketch pad. And the goal of these 15 weeks for that project member is literally to put pencil to paper and do a sketch. Whereas we've got another lady who has been swimming twice. She was very concerned about you know, the changing aspect of everything. So the volunteer met with her. They can do, if they're local enough, do a visit together to get over that barrier of sort of knowing where everything is. And she's been going regularly, so she sees the same people. And it's not a best friend or anything, but she feels she's part of the same group of people that go swimming on a Tuesday at 11 o'clock. So referrals for that project are anyone over 18 plus who's experiencing significant loneliness, but they recognise somewhere that they want to change. They are ready to make a step. And we can take carers who are, you know, having caring responsibilities, but obviously have lost a lot maybe of their own connections and social life. It's not a befriending call. It's not just a lovely chat. It is that, but there is an end goal to it as well. And we cannot run it without volunteers. So, you know, also like many of our services, it's pretty much volunteer supported, and volunteers get DBS check and referenced, and they get basic training, but they're not trained to support someone in a current mental health crisis or who's currently experiencing homelessness. So our website got lots of stuff on, and if nothing else, Loneliness Awareness Week is coming up 9th to the 15th of June. So even if you just mention it in a team meeting, get people talking, have a cake sale, have a look at our Loneliness Awareness Week stuff as well. Yeah, I think that's me. Any questions?
I have a comment. I think it's brilliantly beautiful that you support those that support. Do you know what I mean? Because I think, and correct me anyone if I'm wrong, but I think that often those that do provide support, like caseworkers and such, are forgotten, as though they're made they're like super women and supermen that don't need support. So I'm sure some of the other organizations here do. I know SAFA does make that very clear, but it's so nice to hear.
Yeah, that's great. And we've definitely had referrals through from SAFA. We also run Christmas Cheer. So last year we had 230 people who would otherwise be alone on Christmas Day. Now I know Roger in Bath does Bath very well in one of the schools, and we've connected in the past, but our funding last year for Christmas was anyone in a BS postcode. So Keynsham falls into that postcode, and we have volunteers that actually come from, you know, wider and Radstock. So I'm hoping this year, where Roger can't take somebody to his Christmas in Bath, that we could cover that as well. Makes sense to me. So yeah, and again, Christmas Day volunteering is a great way to change the dynamic for someone's own Christmas who's finding, for whatever reason, Christmas quite hard.
Brilliant, Helen. Thank you so much. I knew about your Christmas things previously. Didn't realise Marmalade Trust was expanding into Bain, so that's fantastic, really, to have that, and we're happy to help you promote. It'd be great to have a catch up with you separately, to have a chat in more detail about what you're doing and how we can help. Be lovely.
Yeah. Definitely, we're still very small. I mean, at the moment we haven't increased any capacity. Obviously, it's, you know, charity level. So
that is what I was going to ask you before we go mad. I just want to make sure you've got the capacity.
Well, it's chicken and egg, because I'm part-time. There's about 8 members of staff in Marmalade Trust altogether, and some are project-based, and it's chicken and egg because we kind of need to prove a need before we can go for funding. It's a classic. And yeah, it's interesting times, let's say, but all good.
Yeah, no, that's
thanks, Alison.
Brilliant. And did you say that your volunteers sometimes will go with people to hold their hand the first couple of sessions?
Yeah. So if it works, which is, you know, often not the case, because volunteer could be somewhere even, you know, not even that local, but where it can, if it does work, then it is lovely. But as we expand, because our, you know, growth gets, you know, if somebody could be in, I don't know, Radstock, and then they could be matched and talking on the phone to somebody in Gloucester, absolutely fine, but they can't do that visit. But I'm working on trying to see how we could facilitate that with some different volunteers that could just be buddies. But yeah, that's on my long list.
No, because St Monica's did a little pilot like that previously, and I think it was really successful, actually, because people just sometimes need the confidence, don't they, to get over the threshold of somewhere a couple of times, and then they make new friends. Mel?
I was just going to say very similar thing, actually, a comment to say that I think what, you know, where possible, you mentioned that somebody will, you know, support somebody, go with them the first time, or the first, because it is, you know, for all of us, we've been in a situation where you think, oh, I like the idea of it, but getting, you know, through the door, getting changed or whatever it might be, is actually the biggest hurdle. Once you've done that and realised that it's okay, then you know, you're not necessarily off and running, but it's a start, that first step. So the fact that, you know, you're able to do that wherever possible is brilliant, because that just makes all the difference. So just a comment to echo really what others have said.
because we found that, didn't we, Mel, with the warm spaces?
Yeah.
That because they were nationally advertised as welcoming places to be, we had a lot of people come through the doors, not because they needed the heat necessarily, but because they were lonely or they were bereaved, and you know, it was really interesting. Yeah,
exactly. It's that language. Also, they know that when they go there, there's no expectation of them. They haven't got to, you know, if they want to chat to people, they can. If they just want to be in the hubbub and absorb that, then they can. So yeah.
Sarah Jane, good question.
Hello everyone, I'm kind of new to this bit, so I've just taken over post of community engagement, and I just wanted to ask a quick question actually, but I don't know if you know much about so we have our companions, and that's one of the things that we've sort of been looking at and changing the model a bit, because quite a lot of our patients actually we discover are kind of lonely, but we're trying to sort of tag them into like local community things and that. But my question is, you're saying about your volunteers doing that kind of research, do you also share information with them within the local area? Because quite often in my job, obviously I come across little bits and pieces, and it would be great to be able to share that with other organisations where volunteers can use that. Our volunteers find us things all the time, and I think actually that would be really good to kind of share that to other people. So what's the best way of kind of sharing that information across with yourselves to be used as well?
Is that for me or?
Yes, that's for you.
Yeah. Hi, I'm Sarah Jane. Sorry, which organisation are you from?
Dorothy House Hospice.
Oh yeah, brilliant. Yeah, my Christmas tree goes there, I think. So when we were doing it just for Bristol, it was quite manageable because Bristol have the Well Aware kind of project, and that was kind of a hub of information. And my volunteers were feeding in when they found something, but as you can imagine, as it's growing, it's becoming slightly unmanageable, that kind of information sharing. So in the volunteer training, I really just put the onus onto the volunteers to Google, to look at local community things that come through the door that they probably don't usually look at. They work a lot with, like you guys would, with the project member to sort of find out what that person actually wants to do, what they're really interested in, trying not to go in with the kind of preconceived idea that everybody of a certain age wants to do bingo or something. So now we've got this big spreadsheet that's very B&NES focused, which I say is more of a starting point. And I know that coming, Alison, isn't there? There's a hub, because I've seen the job advertised where there's going to be information shared within the community and wellbeing kind of signposting thing. I'm sure there's something like that. I didn't look very closely, but I don't know in B&NES, is there a like in Bristol, is there a Well Aware kind of hub where you can search for opportunities for the community groups and stuff?
Yes, it's our Live Well service. Mel, who runs it, is here.
There we go.
But event-wise is harder. So I'm interested in what you found out about the thing you've seen about some kind of information hub.
I'll have to find out. The closing date for the job was today, so I just because it was on M3SG, I think, and I just saw something about a hub, and it was quite database heavy. So I was like, oh, I don't,
Oh, maybe Mel
so
knows.
it was to do with database stuff.
I'll let her. Oh, you're on mute, Mel.
Oh, got excited then. Yeah, I think that's the wellbeing courses job.
So that will be it.
Yeah. So so wellbeing courses is also listed on Live Well, along with, well, when it's my turn, I'll tell you more about it. But yes, so wellbeing courses is I think they're recruiting somebody part-time to manage their wellbeing courses service.
Yeah,
so that's all I know about it. But
you'll find that really useful. So that is courses. When they say courses, it's they are and they aren't really. It's the social prescribing stuff. It's sort of short term, usually 6 weeks of something, maybe digital skills, or it could be more regular sessions that people do, sort of walks in the woods and yoga and different things. But so that will be really useful for your volunteers. And I'm going to pass to Mel now, because it seems the right time to do that, to tell you more about Live Well as well.
Okay, thanks. Okay, yeah, hi everybody. So I'm Melanie Hodgson, and I work for the council, B&NES Council, and so my role is I manage an information signposting resource called Live Well B&NES. the information has been around for donkey's years in different formats. We were part of Well Aware for some time, about 15 or more years ago. We've had lots of separate websites. Previously, it was booklets back in those days. So Live Well is, so who it's for? It's for very specific groups of people. So it includes the Send Local offer. So that is for targeted and inclusive information for parent carers who have a child, young person up to 25 with an additional need. They don't need a diagnosis. So it is anything a parent carer might need to support them. Inclusive stay and play clubs, lots of information about EHCPs. So yeah, I mean, I could talk for hours about it, but so the Send Local offer, which is a statutory, sort of, all local authorities must provide one. The remit being, we need to tell parent carers what's available, in what they can expect to be available in our area for them and to support them. There's also Live Well BANES Adults, which is part of the resource, which is, so the aim of it is to provide information for any adult who may need care or support. And what we mean by that is that it could be old age and frailty, sensory impairment, physical disability, mental ill health, drug, alcohol misuse, any care or support need. Again, no diagnosis, so just if somebody needs that support. It's signposting information, resources, activities for those age groups. There's what I would say to you is have a look, because there's tons of information on there. The breadth of information is vast. And finally, the family information, which is universal family information. So it's the sort of sister site to the Send Local offer. So it's for families, any parent or somebody who's looking after children, anything to support them. Childcare, it's all of the Ofsted registered childcare, which we have a live Ofsted feed come to us. So the information on there is, you know, trusted, up-to-date information. What's on support, loads of things. So those are the sort of audiences. So we used to have it in 3 separate places, but people would say to me, well, I go to the Send Local offer for my child with an additional need, but then I need to look here for my other child who doesn't have an additional need. So it's all in one place and hosted by us. And that means that we can keep the information up to date. So I guess our role is primarily making sure that everybody knows about Live Well, and also making sure that Live Well itself is up to date and a reliable, trusted product. So the primary audiences are those 3 groups of people. So parent carers, young people themselves, families, adults with a care or support need and their families or carer. We work closely with a lot of you in this meeting. It's also a good tool for practitioners. So if you have a support worker or social worker sitting with somebody, they can support them by suggesting different activities. So it's quite a preventative tool as well. It can help with sort of low-level needs before things perhaps become a crisis. Where possible, we co-produce information. For example, we have a whole young person section. I'm not a young person. I don't know what young people want. So we work with young people to say, how do you want this information? Do you want that? You know, you tell us. So wherever possible, we co-produce. And I guess like many of us, I'd love to do more of that, but we're a tiny team and it's capacity. So in terms of new things, we've for the last 3 years, we've hosted the Warm Spaces directory, which Alison mentioned, which is sort of kind of part of a cost of living initiative. So people don't have to heat their home. They can go somewhere and be warm and have a free hot drink in many cases, and also help prevent isolation. That has now just been finished for the year, because we are now in the late spring, summer. So what we're now doing, and this is new and it's the first time we've done it, is we're having cool spaces, which my team's working with public health colleagues on. So it's a slightly different slant in that it's welcoming spaces that may have, you know, there's various, when an organisation registers as a cool space, there's various things they can select to say that they offer. That might be free ice lollies for the kids. It might be free water, you know, a water bottle refill station. It could be a shaded area, lots of different things. I won't go through that now. So that we're hoping that will go live at the very beginning of June. So I'll do a little bit of some comms to tell people it's out there. So I guess my call to action, if you like, for want of a better expression, is if you're registered, and I know many of you are already registered, check your information that it's up to date, and let me know if it isn't. If you aren't registered, please register, because we have about 15,000 visits a month. 15, nearly did an injustice to myself then. We have about approximately 15,000 visits to the site each month. So, you know, it's good to be, if you want to be part of that. And also, if there's any activities, events, new groups that you want us to share, we can do that via our Facebook and Instagram. We reach a lot of people that way. So yeah, that's me, really. That's you want us to, if you want me or my team to come to one of your team meetings and tell you a bit more, give you a, you know, a mini tour to show you the site, we're happy to do that. Thank you very much.
Thank you. Has anyone got any questions for Mel? Yes, Louise.
Oh, I have taken myself off mute. I didn't know if I pressed the button. That sounds amazing, Mel, with the cool spaces. Would you, are you going to be doing email comms about that? Because I think I do get stuff from Chloe from your team about various bits and pieces. It would just be really good for us to be able to promote that, particularly thinking about the health and wellbeing side for older people as
Absolutely.
it gets warmer.
Indeed.
And staying hydrated, because we've got leaflets on staying warm and staying cool. And it's just a really nice thing to be able to promote.
Yeah,
you know,
absolutely.
a really useful local resource that's easy to access.
We will be doing that. At the moment, what
Amazing.
we're doing is we've approached all existing warm space participants and ones that were previously participants in previous years to say, do you want to be part of this? We've also come up with a list of new places. Several of us have thought, oh, they might be quite good, including some outside spaces which didn't apply with warm spaces. And it's going to be a kind of package of information that also has, you know, the Department of Health sort of, you know, how to keep cool in summer. And it's my public health colleagues tell me, and you probably know this, Louise, that, you know, heat deaths and ill health due to heat is more of an issue than the cold, particularly for older people and people with health conditions and little children as well. So yeah, it's quite exciting, actually. I'm really, you know, it'd be great. So we will be doing comms about it, and asking, you know, you all if you could share it as well. So absolutely, watch this space. You'll be hearing from us in a couple of weeks.
Thank you. That's really exciting. Thanks.
Thanks. Anyone else? No. I'm going to move on then to Jenny Crossley. Hi, Jenny.
Hello, so just making sure I came off mute. I know I've done a couple of these meetings in the past, but I was just like rocking up to remind you that I exist. I work for a fuel poverty charity called National Energy Action. Our head offices are up in Newcastle, but I'm based just over the border in Wiltshire. Long association with Bath and North East Sussex. I used to live there, which is why I rock up. But what we do is a combination of lobbying government on all things energy, fuel poverty, sorting all that sort of stuff. We also do a lot of casework around supporting clients to deal with energy companies, water companies, whatever problems they're experiencing. Plus, we can do benefit checks for people. And then what we also do for local communities and charities is we offer training, which is free for on how to do energy advice, so energy and mental health, energy and debt. Simple things you can do, what the priority service register is, and all of that. We also offer fuel poverty forums once a year, once a quarter, so you can then network with other people that are dealing with lobbying and working on issues around energy and fuel poverty. I also have to come and talk to community groups about things like priority service registers, smart meters, all of that stuff. And at the moment, we're particularly interested in reaching out and working with any groups that are dealing with health issues, so Alzheimer's, getting in with the hospitals because of the links between energy inefficiency in cold homes and the detriment on people's health. So like if you get too cold, people can't afford to heat it. Takes longer to recover. You've got more negative health impacts. Obviously, if you can't afford to put your energy on, you might then start rationing your energy, which makes things worse. So if anyone's interested in any of that, please let me know. I think my email is somewhere in the chat, but I can put the link in. The other thing is, if you've got anyone with prepayment meters, we do have funding at the moment for fuel vouchers, which can be stacked with fuel vouchers that you can get from other places. So if you know someone that's particularly struggling, let us know. We can look at getting those issued for you, if that helps.
Brilliant. Thank you, Jenny. Anyone got any questions? Melissa.
Sorry, I'm having problems with the buttons. My mouse is going all over. Jenny, thank you for that. So in my previous life with the former organization I was with, which is Home Start UK, I actually managed a warm spaces that was a partnership with Cadent. And it sounds very familiar with what you're speaking of, and I'm not sure if anyone is. But with that and the energy, now we don't have air conditioners over here, do we? Because our homes are built to retain heat. I have to keep reminding my friends in California and Arizona that our homes are built to retain heat. But the cool spaces thing I absolutely love. And I think that actually, there's a lot of similarities, isn't there, with the warm spaces?
Yeah, no, absolutely. So obviously we're national, so I could be picking up cases anywhere from Cornwall to Newcastle. And what we're always trying to keep in mind is what local support is available for people. So we're signposting to local agencies, the local specialist charities. If there's a warm space or a food pantry, we're letting them know, just because and if it means they don't have to put their heating on for a little bit longer, and save them a bit of money, that's absolutely fantastic. The downside of that, obviously, then is the risk issues around damp, mold, condensation, which, if the property remains cold, it gets more difficult to deal with. So it's always an endless battle trying to make sure that the property remains healthy and safe, whilst the person is able to sort of continue affording to pay their bills. And one of the toughest conversations I have to have regularly with people is the fact that an energy bill range of £80 to £150 a month on average is normal. And a lot of them are just going, but we can't afford that. But standard usage is sort of that range for most households. So, yeah, if that makes sense.
Yes, thank you.
Thanks, Jenny. Any more questions for Jenny? I'm going to move on to Philippa next. Hi, Philippa. Thank you for waiting.
Hi, everyone. This is the first time I've been to one of these meetings. I think my colleague Susie may have attended in the past. So, yeah, I'm the programme manager for Your Park, Bristol and Bath. So we work across parks and green spaces in both cities. The programmes that we deliver in Bath, we've got our green social prescribing programme called Routes to Wellbeing, which is in Twerton Round Hill on Tuesdays, 12:30 till 3. And these programmes are for people who are struggling with their mental health and or generally got challenging lives. So these programmes are delivered by mental health trained facilitators alongside a co-facilitator who's got nature connection experience. So it's a mixture of, it's a nature and wellbeing programme outside in the park. We always provide a free lunch to help support the cost of living crisis, and we can also provide transport to the site as well. At the moment, our Tuesday group, we've got lots of space for referrals. I've put a link in the chat to our website, which is how you can refer if you've got a patient or if you want to self-refer. The links are all on that website there. It's an 18-week programme delivered in 3 blocks of 6 weeks. And yeah, we deliver them in other parks as well across Bristol, but the Twerton Round Hill is the one we deliver in Bath, so it's the most interest to this group. We also have a volunteer group called the Bee Actives. They are a roving volunteering group in Bath, and they do habitat maintenance across several Bath parks. So they meet on a Thursday morning. I can't remember exactly the times. I think it might be 10:30 till 12:30, that sort of time. So they're continuing at the moment. We've had funding from WECA to deliver that, and that funding's ended, but we can continue going for a few more months with that group, and they've done some amazing work. They've created a pollinator trail linking several parks in Bath. It's all got interpretation boards and quite a clever way of putting an interpretation board on a bug hotel, which is made out of one of those gabions filled with rocks and logs and things. So yeah, that's going to be launched actually as part of Festival of Nature in June. There's going to be an opportunity to meet and walk around that trail together, or part of the trail, because it's quite long. And then the other work we do in Bath is our park access work. So we've done some work in Brickfields Park around enabling teenage girls to access the park, because we heard from the community that there wasn't really equipment for them there. It was dominated by boys. So we've recently put in some new equipment for teenage girls. But we also have a big programme across Bristol and Bath, which we've got National Heritage Lottery funding for, and it's called Parks for All, and it's all about working with disabled people and carers to audit their local park and find out what the barriers are, and then help put in place an action plan together. We take them through a series of workshops where it's kind of co-developed. So we're looking, we will be doing one of these in Bath. The park is yet to be decided, but we're in conversation with B&NES Council around that. So that's something to look forward to, and it'd be great to link up with various people on this call. My colleague Rach is our access and community lead who's leading on that programme, so I will certainly be sharing some email addresses to link up with her for that. Yeah, I think that's probably everything Bath based to share. Nice to meet everyone today.
Thanks, Philippa. Any questions from anyone? No. Last but not least, I think it's Rachel. Welcome.
Hello, I was just literally furiously typing away because I'm just conscious of the time and stuff. I'm gonna keep it sort of short and sweet. I've got so I'm my name's Rachel. I'm the community partnerships advisor for Avon Fire, and I am responsible basically for I work in the vulnerable adults team, and I help create partnerships out in the B&NES area for organisations to refer vulnerable people to us for our home fire safety visit service. It's been a long time since I've come to one of these meetings, but just more due to capacity than anything else, but wanted to come just to remind people that we're here, basically, and I know a lot of you are going to be familiar with the home fire safety visit service anyway, but just to kind of promote it, really, tell people, to refresh people's memories what we do, how to refer, and if people want to become a partner, just to get in touch with me, really, basically, then I can easily set up a partnership. I've got, only because I'm prone to forgetting bits of information, bit of a list here. The actual home fire safety visit, if people aren't aware, is a free visit, pre-arranged to somebody's home, depending on what the person's circumstances are, to provide fire safety equipment and advice around reducing risks in their home. Covers all sorts of aspects, from smoking to cooking, electrical safety, candles, nighttime routines, anything really that's going to be good to put in place to help reduce risks. It will what else have we got on there? I'm just trying to think if there's anything. So any equipment that's provided is free. All of this stuff can be, I'll send some stuff in the chat so that people have got stuff to refer back to, but we can provide or replace smoke alarms, carbon monoxide alarms, fire retardant bedding, deaf alarms if people are hard of hearing, lockable letterboxes if people are at risk of nasty things being posted to the letterboxes. Dementia bans as well. If people aren't aware of what that is, it's basically an extra way of safeguarding people who might be at risk of wandering. Louise, only because I know, are you aware of the bans at all? Yeah, you're nodding, that's fine. So they basically are just, they don't hold any person's personal details or anything like that. It's just a wristband that has a disc in it that can be scanned with an app if someone is found wandering, and it has a next of kin's contact number on and a rough area of where the person lives. So it's just an extra way to measure, to get that person home safely, but that can be provided as well during a visit. There's probably other things, fire retardant throws, and all the risk reduction equipment probably that you can really think of, we likely provide. We do as well full practitioners, monthly practitioner training, online or face-to-face if suited. We do them regularly online, but I can do extra face-to-face sessions if that's something that works for the team. That covers in a lot more detail the home fire safety visit, and a little bit about the partnership work that we do, and how to refer as well. The online referral form is really easy, really simple. Probably takes about 5 minutes to do. We can do joint visits and things like that. But if anyone has mentioned, I know I said to Julie about the events, but if there's any events that other people have that they're aware of, and they're going to let me know and I can try to tag along as well. There's a lot of, I'm working at the moment to try and get out and about actually in the community more, still post-pandemic, as much as possible, and getting the word out really, basically. So we rely on our partnership work a lot for obviously promotion and getting the word out. So if you have teams that aren't a partner that you think would benefit, please let them know about us. And again, similarly, like I said, if you're not a partner but want to be, then yeah, get in touch and I can set something up easily as well. Yes, Melissa.
Thank you for that. So I'm really curious about the bands, and I do think you said bands, right?
Yeah,
like wristbands.
Wristbands, yeah.
I'm not sure how long this meeting is, so I don't want to keep hogging the time, but I would love to hear more about that. Is there a link or anything that you can provide? And is there a criteria? Is there a certain person that receives those? Is it anyone that's vulnerable?
Yeah, basically.
Okay.
If you have somebody that particularly they're so that I suppose they're targeted for people who may be suffering with dementia or any memory concerns, really. That is worn obviously on them. I'll put the link in that has the direct information on it. I'm gonna throw loads of stuff in the chat just before I leave. And I've actually, as it happens, I've got your email saved separately. If you don't mind for me to send you an email, because I've been trying my hardest for months to get hold of somebody from SAFA to set something up, because we have Help for Heroes and British Legion as well on our partnership list that I'm really trying to work. My husband's a veteran and I'm really trying to get, it's an area that is there's a big gap that has a lot of potential for support. So if you wouldn't mind, I'd love to.
No, absolutely. That's what we're here for, right?
Yeah.
We're stronger as one when we all come together.
Yeah, definitely. Thank you. Louise,
got a question for Rachel.
Thanks. Yeah, with the bands, are they connected to the Herbert Protocol? So the idea that you can register with the police if somebody has dementia or Alzheimer's or a cognitive decline and they're at risk of wandering and getting lost, you can register with the Herbert Protocol, and it means you can explain to the police that it basically is it's a more discreet way of being able to kind of support somebody, that carers and families can get that support from the police. And we've used it with my own family, my great uncle, and they were absolutely incredible. 4 police officers came out, paramedics came out. They were absolutely incredible. They gave us so much time. And I wondered if it would be worth linking your bands with the police to get it registered alongside the Herbert Protocol, just so that then it's a connected way of supporting those vulnerable people. Because of course, if somebody goes wandering in the middle of I say it's less dangerous during the day, but more people are about, so it's more likely for someone to see a confused person and then possibly interact in a positive way to get them help. If it's 2 a.m. in the middle of December, it's cold, it's dark, it's dangerous. It's dangerous for anybody to be out at that point. But like, I'm just wondering if that way, then if somebody did encounter them, or one of us, you know, one of our support workers or a volunteer that worked in this sort of this sector found someone, they'd know maybe what to do. Sorry, that was a bit of a rambling question. But...
No, that's fine. I'm trying to remember the beginning of it. It's a good question. Is it Herbert, did you say?
Yeah, the Herbert Protocol. Yeah.
Because I know only think about it because the wristbands are joint with the police and the fire. So I would be surprised if they weren't linked with that, because of the fact that they provide it as well. But I will find out.
Sure.
To confirm.
Yeah, when you were saying it, it just sort of was pinging in my mind, being like, I wonder if this is connected to the.
Yeah.
I think it might be that's sort of, it's come out of it the other way, that the Herbert Protocol developed this and then they've linked with you. Maybe. So it may be that I'm thinking the other way round, but it's just a useful thing to know. Like the Herbert Protocol is a useful thing to know about as well, just because it's a great way to register if someone's vulnerable. I think I don't think it's just limited to if someone has Alzheimer's or dementia. I think it does count for anyone who's got that vulnerability. Thanks, Julie.
Thank you, Julie. Yeah. The information that she's just shared is probably exactly the same as what we've got on our website as well.
It's also just because I had a client the other day and we had a long conversation about all of this. So this is
becoming really a lot more popular. The more people I tell about it, they go, "Oh, that's a really good idea."
I'll feed that back to our wellbeing support workers as well, so that they know that it's available.
Awesome, thank you.
Well, thank you. Anyone got any more questions for Rachel? No? And David, you joined us quite late. We'd nearly finished, but you're very welcome. Do you want to?
I'm very sorry about that. I'm squeezing in between meetings.
But if there's anything you want to share with the group, the floor is yours.
Nothing specific. I'd just like to keep in touch with this group, although I've sort of failed today, but hello. I'm happy to brief you on stuff Age UK B&NES Aging Well programme is doing, if that's of interest to anyone.
I think it would be.
Okay, so this is a 2-year programme for people who don't know, or 2-year funding initially. We're just starting the 2nd year. The basic idea is to develop, a kind of advocacy group and a wider group of interested older people to try and affect change in B&NES on a wide number of fronts. So at the moment we're midwifing. Do I like that word? Yeah, I think it's a good word. We're midwifing this group into existence. We have our leadership group having met and working on things like terms of reference and their first meetings. This is a kind of small executive group of older people, not Age UK paid people, volunteers, to act as a steering group for this larger group we have several hundred people interested in playing some role in it. So that group is being formed. I think the idea is there isn't much work at the kind of equalities level involving older people in B&NES advocating for change across a wide range of spheres and sectors. So the council is one of our key interlocutors, and they don't seem to say much about older people, for instance, in their strategic evidence base or corporate plan. So that's the main thing we're involved in at the moment. We also have a bunch of events, etc., coming up. For instance, Joy in Aging Day on June the 11th. These are ticketed events linking toddlers and older people. And I think we're sold out, certainly of the cooking event. I'm not sure about the crafting event. We have also just started a project about transport and food insecurity with the University of Bath and with the council transport people. So this is looking really at public transport and food insecurity, and the Age UK Aging Well programme bit of it is about essentially training bus drivers and developing standards for bus companies for dealing with older people. And we also have a conference coming up this week with the University of Western Ontario, who are a leader in Canada in developing age-friendly cities. So that I think is available if anyone's interested on the 22nd in the afternoon. It's an online conference, obviously, with Canada. And what else? We have also just received funding for a project to enhance volunteering support. Sorry, enhance people going into volunteering, specifically older people, and into employment. And that can mean back into employment or back into volunteering. So we're just starting to work out how best to do that at scale over the next 3 years. I'll leave it there because those are the main things. If anyone's got any questions, hit me with them. Martin.
Yeah, I was interested in the bus driver training. Are you working with WECA on that? Because BANES isn't really the. I mean, I know it's very confusing with BANES and WECA in terms of transport, but so WECA will fund all the what's called West Local Transport Schemes. We've got one in Keynsham. There's various ones throughout WECA, and they're obviously working with older people, and also there's the Dial-A-Ride commuter transport schemes, again funded by WECA, have less to do with BANES as well. So I don't know whether you're working through the WECA transport because they're more directly involved in transport than possibly BANES.
We're starting with the park and ride drivers who are within the remit of BANES Council, not WECA. And we're starting with them because we have access to them, essentially. We've had trouble getting access to WECA on this subject, and hopefully that will change because the BANES Council Transport Planning Lead has just moved over to a similar role in WECA, and she is one of our co-partners in this funding. But the idea is to start with Park and Ride, see how that works, and then roll it out. As for community transport, this is about public transport, but I know that Age UK and 3SG are working on a, what do you call it, a review with a view to overhaul community transport generally, or uplift community transport generally, help coordinate, etc. But then they work with
WECA on that. Again, WECA provide all the funding for community transport, so presumably they're involved.
Yes,
will
they
have
are
more influence than Age UK will, who are just an advice body.
Absolutely. I don't know tons about that one, but I know they are talking to WECA.
I just think you need to engage. Okay. I think you just need to engage with WECA actually, because they seem key to that whole of what you're talking about. And if you've got a link there, that's probably really helpful.
Yeah, we have a good link now. I think the previous link wasn't very interested or responsive.
Okay.
Lovely. Any more questions for David? No. And just to flag, David, because you missed it, we've got our community contribution fund open at the moment, which is a Kickstarter fund. Small grants up to £1,000, really, 500 or £1,000. But it's the idea is possibly of interest to your group to kickstart some new projects that benefit the over 55s, and that could be an existing project in a different area. But yeah, and the details are in the chat. There's information on the website. So yeah, closing date's coming up on the 30th of May. So if there's anything they want to sort of trial, that would be ideal for it. Brilliant. Okay. Well, thank you, everybody. It's been a really interesting meeting. Really appreciate you all coming. Pop my contact details in the chat earlier. So if there's anything you think of or anything you think our team can assist with, do get in touch, and have a lovely rest of your afternoon on this lovely sunny day. See you again.
Thank you. Thank you, everybody. Bye. Bye.